Good evening, everyone, and welcome to Compass Health's first virtual town hall. I'm Tom Sebastian, the President and CEO of Compass Health, and I appreciate you joining us on this beautiful late spring evening. Before we begin, just a couple housekeeping items. We have muted your audio and visual during the town hall. If you want to submit a question or a comment, please do so through the chat function to our team member, Missy Judd. And we will be collecting all those questions and responding to as many of them as we're able to either tonight or we will respond after the town hall via email. So I'd like to introduce my co-panelists tonight. Joining me tonight are Compass Health's Chief Medical Officer, Dr. Camus Milam, and our Chief Operating Officer, Stacey Alice. And we're also so pleased tonight to have Jennifer Piplick, the Interim Superintendent of the Burton Health Commission, join us as well. Jennifer has been with Burton for 8 years and is passionate about serving the communities of South Snohomish County, and we couldn't be happier to have her join us tonight. So if you're new to Compass Health, just a little bit of information about us. We are Northwest Washington's behavioral health leader. We provide a full continuum of behavioral and medical support to clients in the community, providing services to them wherever they are and whenever they need us. We provide a full continuum of care that includes a full spectrum of mental health services, also services to children, permanent supported housing services, as well as much more. We serve over 17,000 community members in Snohomish, Skagit, Whatcom, Island, and San Juan counties. Our organization has been around for over 100 years, and we have seen a lot of change. But suffice it to say, we've never seen anything of the magnitude of what we're all experiencing today. These past few months, we've been reminded that now more than ever, we really need to ensure that we are, as closely as we can, marrying up medical and behavioral health services to meet the needs of our community. Here at Compass Health, we champion whole person health. And with the inception of COVID-19, it has never been more important that we find ways to transparently and honestly navigate through the challenges that the pandemic presents to us and to those that we serve who are not able to access care easily in the community. In order to be responsible allies and community leaders, we're recognizing that we are in unique times. At Compass Health, we've started very deep conversations about how we advance further diversity, equity, and inclusion for those that we serve and for our organization as a whole. We need to find ways and take actions to find a better way to support those in our community who are marginalized. So this discussion today is really about you, the community. We want to have this be one way by which we deepen our relationship with you. We are part of you, and we want to really open up a deeper dialogue with all of you, a deeper understanding. And so while tonight we'll be talking a lot about Compass Health, I just want you to know this is really about you, the community, and how we can deepen our relationship together. So it's really no secret to us that we are at a real crossroads right now. We are a frontline provider at Compass Health for those impacted by COVID-19. So many of those that we serve are the most vulnerable to the pandemic, and we have to find ways to meet those challenges of those community members. So we have been working hard as we approach reopening our doors, the community reopening our doors, of really thinking about what the long-term impacts of COVID-19 are going to be on our community. And in addition to that, the challenges we're facing in terms of our recognition, how deep racism runs institutionally in our communities, and how do we also address those needs as well. So we are really trying to figure out how to come together to figure out what those long-term impacts are. The Washington State Department of Health has begun to model out what the potential impacts, particularly of COVID-19, are going to be. And what we're seeing is very alarming. We're seeing a possibility of a higher rates of suicide. We're seeing that people are going to be triggered by the impact of COVID-19, triggered by trauma and other stresses, anxiety, and depression. And we're also aware that we can likely see a big increase in substance use disorders amongst our community members. And most importantly, we also know that we need to reach out to our Black community, our other marginalized community members, and find ways that we can better address their health needs. We know that they are disproportionately impacted by public health crises, and that is certainly the case today, and we need to take action. So in order to be part of the response of the community, we really have a three-pronged approach that we're currently using in order to do our part. The first is to make sure that we have a community-based response that is listening to the community so that we can understand what exactly is happening, and also to anticipate what future needs might arise that we need to address. Secondly, we're creating innovative new ways to open access to services so that folks that really need us, that have not been able to access care at Compass, we need to find new solutions, find ways to reach out and make sure that they get the care that they need. And thirdly, we're continuing the development of our Broadway redevelopment project. This is a region-wide project that is going to be a critical resource in order to meet the continued demands long into the future of the challenges that we're facing today. So first, I want to introduce you again to our Chief Medical Officer, Camus Milam. Camus is going to talk with us about measures we're taking at Compass Health to identify the impacts of COVID-19 and how that particularly impacts marginalized community members and the things we're doing and planning to do to take action. Camus?
Hi, thank you, Tom. So this graphic that you all were looking at there depicts the reactions and the behavioral symptoms that are commonly observed when disasters, whether they're weather related or floods or a pandemic. In terms of reactions, we actually peaked with the honeymoon period in mid-April when the number of cases began to drop, and now we're entering kind of the period of disillusionment, which will be impacted by further waves of infections as they may come along. And is certainly being impacted by the enormous groundswell of protests that we've seen in recent weeks. This pandemic causes and will continue to cause distress and will leave many people vulnerable to mental health concerns and suicidal ideations who did not have those symptoms before. People with and without prior psychiatric illness may experience exacerbated symptoms because of loneliness, grief, or financial stressors. We know, as Tom mentioned, that substance use disorders and mental health problems go hand in hand, and approximately 50% of individuals who have an issue with one of these, whether mental health or substance use, will develop problems with the other during this pandemic. We've also anticipated an increase in domestic violence as a maladaptive response to an exacerbation in symptoms. The Washington Department of Health Behavioral Impact Statement report came out last week and looked at the volume of emergency department visits, social media that was tagged to Washington State, and also the Washington Association of Sheriffs and Police Chiefs reports. They do show that domestic violence offenses remain elevated approximately 17% year over year from April 6th to May 31st. Expressions of anxiety in social media have continued to increase since March, and ED visits, emergency department visits for psychological distress, have been rising across all ages over the past few weeks. So this is being borne out. Over the past several months as well, our nation and our state have clearly learned that First Nation people and African Americans are more likely to suffer severe illness from the COVID-19 virus. They are also more vulnerable to experience serious psychological distress and to die by suicide at higher rates than other ethnic groups. Significant barriers hamper our clients' ability to access appropriate care and treatment of both mental and physical health issues due to systemic racism and stigmatization, which have for a long time impacted the social determinants of health and have been made even clearer by this pandemic. We know as well that people with serious mental illness die from physical causes an average of 14 to 20 years sooner than the rest of us, regardless of ethnicity, which further emphasizes the vulnerability of those that we serve. At Compass Health, this pandemic has renewed our commitment to focus more acutely on using all resources available to us, including new technologies and the federal government's commitment to telehealth to mitigate the effect on vulnerable individuals in our community. At Compass Health, we have a lot of experience in developing situation-specific responses to shared traumas. Following the Oso mudslide and the shooting at the Marysville High School, our teams were there to help our communities. Today, we continue building on our expertise to ensure that we're meeting the needs of our neighbors. We believe that through our use of the Compass Health Bridge and care rooms, which Stacey Alice will discuss, that we can mitigate the barriers of distance and the lack of transportation to provide the right care at the right time. Another example is our partnership with Genoa Healthcare, which allows safe and timely access to prescription medication that can be mailed to the home, picked up in our clinics in convenient daily packaging. At Compass Health, we've also seen the impact and importance of reaching out to high-risk individuals. We know that times of stress and uncertainty are especially challenging for those dealing with mental health and substance use disorder issues. So it's imperative for us to continue counseling and treatment. Our intensive teams and crisis responders continue to go out into the communities we serve to work with those who need that level of response. Telehealth and even telephonic appointments have been shown in studies to be effective and allow us to reach those in need safely. We've also received and deployed 400 cell phones loaded with unlimited minutes through our mobile crisis outreach teams. In addition to those things that I've outlined, our ongoing next steps to help provide care in our community during these pandemic times include the use of special treatment rooms and safety precautions to provide quick and safe laboratory testing and injections for clients who must still come to our clinics. The promotion of resilience through connection, renewed sense of purpose, fostering adaptive and flexible thinking, and a focus on hope. Physical distancing does not have to mean social isolation. And at Compass Health, we promote social connection by sharing the resources our community partners provide and making connections with them. We also anticipate that we will continue, even when the pandemic is eventually no longer upon us, to provide increased telehealth resources via the Compass Health Bridge to break down barriers to access that many of our clients experience, as well as to reduce the risk of virus transmission. And we will advocate to permanently change the federal telehealth rules to allow this resource to continue. Back to you, Tom.
Thank you for this overview, Camus. In addition to anticipating these future needs, our team here at Compass Health has been working every day to make operational changes to improve access to care and the provision care to all our community members, no matter what they need and when they need it. I'd like to turn this over to our Chief Operating Officer, Stacey Alice, to describe some of these changes that we've been initiating here at Compass.
Thanks, Tom. So you're right to note that our organization has really pivoted to anticipate changes and respond to our clients' needs. And the Compass Health Bridge mobile telehealth system is a great example of that. The system has 3 parts. It enables behavioral health providers to connect virtually with clients in community and home-based settings via a HIPAA-compliant secure video platform. So those 3 parts of this system are a cloud-based platform, a proprietary mobile device like an iPad that providers or other team members can bring to clients' homes or community settings. And the device pivots nearly 360 degrees, allowing providers to move the device and view a client's environment and body language. You can kind of see in the picture there what that device looks like. It's small, it's mobile, and user-friendly. And the third piece of this is a secure portal that enables clients and providers to log on using their own devices to connect from wherever they are. We began piloting the mobile devices last fall across select youth and adult programs with the idea that it would become part of the fabric of Compass Health over time. Once the COVID-19 pandemic hit and clients began adhering to social distancing guidelines in March, we saw steep declines amongst clients who were coming in to receive services. Participation was dropping by over 20% week over week. Suddenly it seemed more important than ever to expand our use of the Bridge system and get people back into care. So in a matter of weeks, we trained around 400 behavioral health professionals to deliver care remotely and enabled many clients to communicate via their own devices. The Bridge system allows us to maintain social distancing, or as Canvas says, physical distancing, while still serving as a lifeline for whole person health. To support hospitals, we also provided 6 Bridge mobile devices to emergency departments in Skagit, Island, San Juan, and Whatcom counties, enabling our professionals to complete behavioral health assessments remotely. This eases pressure on the emergency departments and reduces exposure for everyone. For clients or families without easy access to Wi-Fi or their own devices, we've established care Bridge rooms at our offices. So clients can come to their usual office, sit in a safe private room with telehealth equipment, and participate in therapy sessions with their provider who's working remotely. Just to give you a sense of the rate of expansion of our telehealth system, here's some numbers. In January and February this year, we provided about 1,100 telehealth services. In April and May of this year, we provided almost 8,200 telehealth services. What excites me the most about this system is how adaptable it is to our future needs, because the system allows for dramatically improved client experiences, which allow individuals to receive real-time care with minimal travel and access to services in a convenient, comfortable setting. Many of our clients are reliant on public transportation, and as our transportation systems have scaled back during the pandemic, being able to receive care without taking a bus is a significant step forward. Expanded access to care means new pathways to underserved communities who've historically been overlooked by the healthcare system overall. With Compass Health Bridge, we can continue to respond to and provide care to our community's needs. The system offers enhanced efficiency and greater ability to meet the community's needs by reducing travel time for clinicians, allowing team members to provide more instances of care. So our outreach teams can spend more time seeing clients and less time on the road. The solution also allows us to load balance across teams, which can reduce wait times for appointments. So for example, if one office or a location has an increase in referrals, new clients who are coming in and planning to get their care via telehealth can be seen by a clinician located anywhere in the agency. Let's imagine our Smoky Point sites experiencing a surge in referrals, but our Coopville site has capacity to see a new assessment right away. We can connect that client to a clinician in the Coopville office for the same quality experience and ongoing care. And then regardless of location, the Compass Health staff can collaborate to attend important weekly or monthly patient meetings, providing a full spectrum of care. So with that, I'll send it back over to Tom to talk about the importance of our ongoing partnerships.
Thank you, Stacy. We would not be able to provide this comprehensive, high-quality behavioral health services to the community if it was not for the partnership with and investment from critical community partners. We are so pleased to have Jennifer Piplick here again from Burton Health Commission. And so I'm going to turn it over to you, Jennifer.
Hello, thank you to Tom and the team at Compass Health for having me here this evening. For anyone unfamiliar with the Burton Health Commission, we're the program of Public Hospital District Number 2, Snohomish County. and serve the communities of Edmonds, Linwood, Mount Lake Terrace, and the surrounding areas. We provide funding to organizations and community groups that align with our priorities, working to improve the health and well-being of our whole community. In 2019, that included nearly $7 million in grant funding. At Verdant, we recognize that stabilizing behavioral health is critical to a person's whole health, and we see Compass as uniquely positioned to support this work on several levels. Compass understands whole person health and the client population they serve, and as a result, we've partnered with Compass over the years on a number of programs, including the ones you see listed on the slide before you tonight. I'd like to highlight a couple of these programs. The first is the Community Paramedic Program. This started as a partnership with South County Fire, in which they designated community paramedics whose job it would be to follow up with high utilizers of 911 and our emergency systems to support their non-emergency needs. As you can imagine, it's not uncommon for fire or EMS personnel to enter a residence and recognize the individual or family has needs beyond the emergency that generated the call. But until the Community Paramedics Program launched, they were unable to address those needs. South County Fire ran this program with some financial support by Verdant, and in recent years, we've expanded the program in partnership with Compass to include behavioral health support. South County Fire recognized their paramedics were not always equipped to respond to behavioral health needs, and so there are now embedded Compass Health staff, including a licensed mental health clinician and a peer counselor, working alongside the paramedics. The addition of Compass's work in this area has strengthened the program immensely, and we're very thankful to have it in our community. I want to pivot now and focus on the telehealth support that Verdant has contributed. Our Board of Commissioners recognized that COVID-19 would impact our community's health beyond just the virus spread, and so established an emergency fund to assist with mental health and access to care needs. The need to physically distance ourselves, coupled with the complexities and uncertainties of COVID-19, meant telehealth was no longer an option, but rather a necessity. We were concerned that existing and new clients with behavioral health needs would go without support, and we wanted to get ahead of that. As a result, in early April, we committed nearly $100,000 to ensure our residents would be served by Compass Health clinicians using telehealth technology. Compass's ability to respond quickly and adapt given the circumstances is really remarkable, and a reminder of the value created when you establish long-term successful partnerships. In closing, I just want to thank the Compass staff for all the information they've shared tonight. I'm pleased we've been able to provide support to this work to ensure our residents can access care. Thanks so much.
Thank you, Jennifer. I would like to just comment on one last initiative that we have going on here at Compass Health, and that is our permanent supported housing project on our Broadway campus, by which we are creating 82 permanent supported housing units for homeless community members who also experience behavioral health challenges and often have concurrent medical issues that they need addressed as well. Now more than ever, we need resources such as these housing units in order to be part of the solution as we think about the long-term impacts of COVID-19. So you can see on your screen the progress that we're making in our project. We're happy to say that the project was not impacted by COVID-19 due to the nature of the project. And so we are on time and we are on budget, and construction is underway as quickly as possible in order to have this resource ready for the community as soon as possible. In addition to the 82 units, this particular project will also have 10,000 square feet in order to provide services not only to the residents who will be living with us, but also will house some of our outreach teams to some of our most marginalized and vulnerable community members. This project is an exact embodiment of the impact that you and the community can have. There is no way we would be doing this project if we did not have the support of those of you in the community. And so here's a really tangible way by which we can work together, partner together to create solutions that will really meet the needs that are coming to us so quickly, fastly and furiously, it seems. So with that, I want to thank my fellow co-panelists here tonight for joining us. We do have some time left and have some questions that were submitted to us. And so we're gonna now pivot over to answering some of these questions. So I'm just gonna pull out a few of them here. So one community member writes, what is the best way to assist family or friends experiencing anxiety, fear, and frustration during this time? Stacy, would you address this one?
Sure. So we get this question a lot, even when it's not the middle of a pandemic. And I always like to encourage folks to follow the action steps from the National Mental Health First Aid Model. The acronym for that is ALGE. And the A stands for assessing for assessing for risk of suicide or self-harm. And that can sound pretty scary, but really in this context, what it means is listening to people, hearing what they're saying, checking in with them regularly. And if you have concerns or things that they're saying that are sort of setting your alarm bells off, to follow up, talk to them some more, get a sense of how serious it is, because you may need to refer them on to some additional assistance. The L in ALGE stands for listen non-judgmentally. This is a time for us to be checking in and really hearing how people are doing. And sometimes that's what they need from us. It's just that opportunity to be heard. The G in ALGE stands for give reassurance and information. So reassurance can be things like just offering emotional support. It can be normalizing the fact that, yes, this is an incredibly stressful time and you're not alone in those feelings. It can be offering information like behavioral health services are still available, right? The crisis line is available, services are available in the community. The pandemic has not sort of shut down those services. And so that might be information people need to hear to know that there's access. And then the last two letters of ALGE are E and E, encourage appropriate professional help and encourage self-help and other support strategies. And I think those 5 steps are really always good advice if you are talking with a friend or a family member or neighbor and you're worried about them. It kind of applies in many situations. So I hope that's helpful. And then Camus, we have some questions about prevention strategies for children and how to help them understand what's going on, and also how we can help elders that are isolated and afraid. Do you want to take that one?
Sure. So many of the things that you said, Stacy, actually also apply both to children and to elders. And I like that acronym, that ALGE, that's a good one. I'd also like to mention too that we have a lot of good resources on our website at compasshealth.org, some of the Mental Health America, and also cdc.gov/COVID-19 has some good resources too. A thing to think about when you're considering children is to always remember that the most impactful form of communication is parental or caregiver behavior. So we're all upset and frustrated by the things that are going on too, but we need to be mindful to tailor response to the child's age and situation. If you would respond to a 5 or 6-year-old child who's worried and upset a lot differently than you would to a teenage child. So tailor that response. Modeling calmness is a good one too. Sometimes we don't feel particularly calm with the things that are going on, but taking that deep breath and modeling that helps children with their own response. Maintaining routines is another really important thing, especially now when kids are home from school, camps aren't happening, parents are home, they're not used to that. But maintaining routines about getting up at the same time, having meals at the same time, bedtime at the same time, those sorts of things will help children as well. And again, like Stacy mentioned, listening actively is very important. Children don't necessarily speak using the same kinds of words and phrases that we do, but you can draw that out of them, allow them to talk to you about it, and ask them, tell me more about that. What does that feel like? What did you think? And then validate their feelings. There aren't any wrong feelings. So yeah, I can see why you thought that might be happening. Another thing that you really want to do is help children by directing them to the facts of the situation. You can look things up together if they're old enough to do that. You can make sure that they know what reliable websites are. You can talk about how valid things are that they're seeing on social media. So those might be good strategies for children. Elders, again, many of the same things go as well. One of the things we see with our elders is that sometimes they're really isolated and afraid. We know that older adults are at an increased risk, not only from the COVID-19, but also from acute and chronic medical conditions that they may not be able to get in and see their healthcare provider for as easily, or they might be afraid to go in and see them. We should encourage our older adults that if they have chronic conditions, they should continue to see their healthcare providers for those. Something that can be put off easily in a younger person might become rapidly more serious in an older adult. It's also true that the loss of exercise and maybe even loss of proper diet can lead to deconditioning, can lead to falls, and even cognitive decline when we don't have that stimulation. So an important thing to remember there is that even though we have to physical distance, we need to pay attention and make sure that we don't socially isolate our older adults. If there's someone in their home who can teach them how to teleconference, then we have FaceTime chats with older adults. If they're in a care home and they have an iPad or someone has a smartphone, you can FaceTime them that way. Ensuring that they make scheduled medical appointments, as we discussed, really something important to do. So again, thinking of all of those, writing, older adults can write, sending them letters and cards, or even if you can stand outside a window and wave, or talk on the phone while you're looking at each other through a window might be something to do. So again, the key points there are to remember to keep routines, tele as much as you can with people who are isolated, and there's a lot of ways that you can do that now. A lot of, you don't have to use FaceTime. Zoom actually has some platforms that you can use. There's a lot of folks out there who have platforms. Ensuring that they continue to get their medical care for the older adults and stay in touch and listen. Hopefully that's helpful for those.
Thank you so much, Camus. I want to read another question that came into us. With intense discussions now underway regarding the role of police officers, what would it take for 911 calls regarding substance abuse or mental health issues to be directed to a social service or mental health provider rather than a police officer? So I'd like to start by talking a little bit about the system we currently have in place and have been working hard on with partners in order to ensure that 24 hours a day, 7 days a week, community members have access to services if they find themselves in a crisis related to a behavioral health challenge. We have mobile crisis outreach teams in all 5 of our counties in our region that respond in person 24 hours a day, 7 days a week. We have very strict guidelines around response time, and our intent is to respond as quickly as possible to any community member that is in crisis. We have a great partnership with Volunteers of America who run the Care Crisis Line, and I think we have all worked hard over the years to promote the crisis line so that at the initial point of crisis, people will call the crisis line rather than 911 if the situation is related to one of our community members that's experiencing a behavioral health crisis. In addition to that, there is a massive effort going on in our state to provide training to police officers. It's just a fact that people will continue to call 911 when they feel they're in distress. That's a fact. So training is occurring that's required by the state for police officers in interacting with community members who are facing behavioral health challenges. Here in our local communities, many of our local police departments and sheriff departments are doubling down on those state requirements and providing additional training. Also, we have many communities where law enforcement is joining community agency partnership groups that are identifying specific community members who are coming to our attention maybe repeatedly, and it's clear that they need more than the care they're currently being provided, and that the proper care to provide to them is of a behavioral health nature. And so these kinds of partnerships are critical in identifying those community members and coming up with really good plans where we're all working together on their behalf. That being said, there are also some really great innovations going on as we recognize that the police are going to continue to encounter community members, again, who are facing behavioral health challenges. More and more departments are embedding social workers within their law enforcement teams. And those social workers are now riding along as part of the team with law enforcement when they're responding to 911 calls in the community. This is a vital resource. For communities where that may not be happening, we're working really hard to strengthen the partnership between our mobile crisis outreach teams and law enforcement. It's a top priority for our teams that when we get a call and it's coming from law enforcement, we understand that we need to respond to that call as quickly as possible to support those community members and to support our partners in the police and sheriff's departments. Finally, we have 2 crisis triage centers, one here in Snohomish County and one in Whatcom County. Those centers are open for direct law enforcement, direct EMS and paramedic drop-offs. Our intention is to make sure that there is a good avenue for law enforcement when they are interacting on their own with someone who's clearly in crisis, that they can just bring them to our center, drop them off, takes 5 or 10 minutes, and then they can be on their way back onto the streets, keeping us safe. So we are working really hard to make sure that our doors to those crisis centers are open, that we are welcoming, and that we have a great breadth of services to provide the community members that access care. This is a really, really big priority for us here at Compass Health. It's a big priority for our communities, and we're just going to keep listening and working to improve that partnership over time. We do have time for a couple more questions and a couple that have come in while the town hall has been going. I'm going to start with one that's going to come your way, Stacy, and then you might want Camus to follow up. That question is, how does Compass Health's work diverting individuals from using the emergency room or other inappropriate care? Stacy?
Great, thanks, Tom. Yeah, well, you mentioned one of them just a moment ago, which is our triage facilities. So whether an individual is coming to us through a law enforcement drop-off or a self-referral or a community referral, or even now, at least in Snohomish County and soon in Whatcom County, we'll be able to take drop-offs from the EMTs. That is an alternative to emergency departments. And so if the presenting issue is behavioral health, they can come to triage, get that support, get, have a plan, an action plan for how to stabilize and move on in their care. That means we don't have to have those folks sitting in an emergency department. And that happens in close partnership oftentimes with those mobile crisis outreach teams that you talked about. For clients who are actively enrolled with us, we have a number of programs specifically designed for clients and families who need, intense services, multi-system care, both for adults and kids. And those programs are available 24/7. So if I am having a crisis after hours, instead of taking myself to the emergency department, I can call and speak to a member of my treatment team in the middle of the night and get coaching, someone who knows my treatment plan, who knows my crisis plan, who can talk me through it and strategize how I'm going to get through this difficult time. And so those programs are specifically designed to create other options for those clients to take pressure off the emergency systems and the emergency departments. And then, of course, just the fact that people get ongoing care and have access to their provider, even for routine outpatient behavioral health, allows us to not just provide that care, but watch for warning signs that someone may be having extra difficulty, may be decompensating, and allows us to intervene before it gets to that stage. So really across the continuum, we're looking at how do we resolve crises or help the individual resolve those crises in the least restrictive manner, in the least sort of impactful way possible, so that they can gain those skills to self-regulate those crises and build those resources up to keep pressure off those higher levels of care. Camus, did you have anything you wanted to add?
Well, I think one thing that is also really helpful, again, so for urgent situations, if someone's having a problem with their medications or another kind of urgent but not emergent situation, is the new scheduling process that we've moved to, which is really allows for people to come just in time. That's what we call it. So if you have a need, you can call your clinic and hopefully get in to see your own provider or clinician within the next 2 to 3 days. So I think that really is helpful as well.
Thank you, Camus. We have just a time for one last quick question, so I'm just gonna throw this one to you, Stacy, for a quick answer. The question is, what is one of the primary challenges your clients have faced with telehealth, and how did you address it?
Yeah, that's a great question. I think the biggest challenge is just access. So actually using the devices or using the system hasn't been, an initial learning curve, but everybody, once you get it, you got it. But really the issue is that not all of our clients have easy access to the internet or have a device that is able to do a video call. And in those cases, we've had a variety of possible solutions, including, as Camus mentioned earlier, getting donations of phones that we were able to distribute out to those clients. We've also, in some of our intensive teams, literally driven out there with, an iPad or another device or the mobile device, set it on the porch for them and gone to the car and had the session. So we can do that safely through the telehealth device and then retrieve it afterwards and disinfect and move on to the next client. But also setting up the care rooms at our offices. So the clients, many of our clients still can come to our office, but they may come to one of those care rooms to have their service via telehealth. And then there's someone there also to help get them roomed and get the system set up for them. I think the biggest challenge has really just been not everybody has reliable internet or even access to internet or a device. And we've had to come up with some other solutions for those folks.
Thank you so much, Stacy. Well, we are coming to the end of our time together today. I want to honor your time and make sure you can get out and enjoy this beautiful weather. As I close, I want to thank each and every one of you for taking the time out of what I know are your very busy schedules to spend time with us. And it's so important that we have this opportunity to interact with you and listen to you. If you had a question that didn't get answered, we will be responding to any question that got submitted. And so just deepest appreciation to all of you. I want to give a special thanks to Jennifer Piplick for joining us tonight, and also thank my very astute and talented colleagues, Stacy and Camus. Thank you to both of you. So again, for all of you, I want to reinforce that Compass Health is here for the community. We want to listen to you. We want to partner with you and respond with you to the needs that are arising in this most unprecedented time. We're here for you and we want to help. That's what we do. So I want to thank you for your time. Have a great evening.